King Charles has been less visible in public than at any point in his reign so far, and that pattern is worth paying close attention to. In the next 25 minutes, I am going to walk you through exactly what the documented public record shows, what official statements have and have not said, and what the people who study these institutions professionally are watching right now. Stay until the end, because the final detail I share reframes everything that comes before it. Before we go any further, here is how this channel works. Everything discussed here comes from publicly available reports, official palace statements, verified media coverage, and the documented public record. When something is confirmed, I will tell you it is confirmed. When something is reported but not yet officially verified, I will say that explicitly. When I walk through a possible scenario, I will label it as a scenario. That distinction is not optional on this channel. It is the whole point. If you follow royal coverage, and you want analysis that is clear, structured, and grounded in what we can actually verify, subscribe now. I post updates as credible new information becomes available. To understand what is happening right now, you need to understand the context of the past several weeks. There are 3 threads running through all of it. The first is the public schedule. King Charles has made significantly fewer public-facing engagements compared to the same period in previous years. Several appearances have been adjusted or covered by other members of the royal family. This is not speculation. It is documented in the official royal calendar, and it is visible. The second is the official palace line. Buckingham Palace has consistently described the king as continuing his recovery and receiving ongoing treatment. The language used across statements has remained stable, carefully constructed phrases that are accurate as far as they go, but contain a limited level of specific detail. That is a deliberate communications posture, and it is one the palace has used in previous sensitive periods. The third is media and public reaction. Internationally, royal correspondents have begun raising questions about the pace of recovery relative to what was initially communicated. In the UK, mainstream coverage remains measured, but the volume of commentary around the situation is increasing. Viewers and readers are asking questions that official statements have not yet answered in full. That is the baseline. Now here is what that means for where we are today. This next detail is important. Let me divide this into 2 clear parts: what is confirmed and what remains unclear. What we know, confirmed. King Charles's cancer diagnosis was publicly disclosed by Buckingham Palace. Treatment is ongoing. The king has continued to conduct some duties in a reduced capacity. Documented correspondence and private audiences have continued. But his visible public-facing schedule remains substantially lower than before the diagnosis. Several senior members of the royal family, including the Prince and Princess of Wales, have taken on an expanded public representation role. This is publicly documented, acknowledged by the palace, and consistent with how the institution manages periods when the monarch is receiving intensive medical treatment. What remains unclear, not confirmed. The specific type of cancer has not been publicly disclosed. The detailed treatment protocol has not been made public, and the question of whether the treatment is achieving the results that were anticipated has not been directly addressed in any official statement. Some commentary has raised questions about the pace of recovery. There has been no official confirmation of any change in condition. I am noting this because it is part of the public conversation around this story, but it should be treated as unverified unless and until an official statement or a named credible source addresses it directly. What I can say, based entirely on publicly observable information, is that the difference between the level of detail in official statements and the scale of public representation by other royals is something observers are watching closely. Watch how this develops, because the next section explains why the institutional context matters as much as the medical one. So why does this matter beyond the very human story of a person managing a serious illness? There are 3 reasons, and they operate at different levels. It's important to remember that beyond any constitutional or institutional discussion, this remains a personal health matter. A family is navigating something genuinely difficult, and that human reality sits underneath everything else we are about to discuss. The first reason this matters institutionally is the question of royal duties and schedule continuity. The monarchy is not purely ceremonial. The king has constitutional responsibilities, state appointments, formal functions, Commonwealth engagements. When those are handled by delegation over an extended period, it creates an accumulation of adjustment that the institution has to manage carefully. That process is working, but it is not invisible. The second reason is public messaging and how it interacts with public confidence. The monarchy's ability to function rests substantially on the stability of public trust. How a health situation is communicated, the timing, the level of detail, the consistency of the language, directly affects that trust. The current communication strategy is consistent with how the palace has handled sensitive situations historically. The effects of that communication strategy are now part of the public conversation, and that is worth understanding on its own terms. The third reason, and I want to handle this carefully, is the succession question. The succession itself is constitutionally and legally clear. Prince William is next in line. That does not change. But a prolonged health situation naturally focuses attention on the eventual transition and on the institutional readiness around it. Asking those questions is appropriate. The line this channel holds is between legitimate institutional analysis and speculation about specific, unverified private matters. We stay on the right side of that line. Now here is what that means in practical terms, and this is where the observable signals become useful. People who study constitutional monarchies professionally focus on specific observable signals when assessing a health situation of this kind. Here are the three that carry the most weight. Signal 1 is language change in official statements. This is the most reliable indicator available to anyone following from the outside. Pay close attention to the specific words the palace uses, and notice when those words shift. There is a meaningful difference between recovering well and expected to return to full duties and continuing treatment with a reduced schedule. Palace communications teams are extremely deliberate. A shift in established language is not accidental, and it is worth tracking across multiple statements over time. Signal 2 is the delegation pattern. Specifically, who is appearing in place of the king, and for what categories of engagement. Routine ceremonial appearances being covered by other royals is standard practice and does not signal anything unusual on its own. What carries more weight is when the nature of the delegated functions shifts toward engagements that have historically required the monarch personally. Tracking which categories of duty are being affected gives you a much clearer picture than any single statement. Signal 3 is how information is reaching the media. Changes in briefing patterns can sometimes indicate a shift in communication strategy. When royal correspondents at major outlets begin noting publicly that their access to information feels different from previous periods, that observation is itself a data point. It does not mean something is being hidden, it means the communications approach has adjusted, and understanding why that adjustment is happening adds useful context. This next detail is important, because those three signals connect directly to the scenarios worth thinking through. I want to walk through three possible scenarios for how this situation develops. I want to be direct. These are analytical possibilities based on publicly observable patterns. They are not predictions, they are not insider information, and they are not confirmed reporting. They are scenarios, and I will label them clearly as such. Possible Scenario 1: stability and a gradual return. The treatment achieves its intended results, the king's condition stabilizes, and a structured return to public duties occurs over the coming months. The palace increases the specificity of its communications as the situation improves. This is the direction the official statements are pointing toward, and it remains a genuine and realistic possibility. Possible Scenario 2: an extended period of limited engagement. Treatment continues, but the recovery timeline extends beyond what was initially anticipated, and the king maintains a reduced but ongoing role. Private duties, selective public appearances, with the Prince and Princess of Wales carrying an expanded public profile for a longer period than first expected. The institution continues to function, but what was framed as temporary becomes a more sustained adjustment. Possible scenario 3, a formal constitutional adjustment. This is worth knowing about purely as an institutional fact. British constitutional law includes established provisions for situations where the monarch is temporarily unable to carry out certain constitutional duties. The appointment of councillors of state, senior members of the royal family who can perform specific functions, is a legal mechanism that has been used before and exists precisely for situations like this. If those provisions were activated, it would not be a constitutional crisis. It would simply be the institution using the tools it was designed with, but it would publicly signal the seriousness of the situation in a way that current communications have not. Again, 3 scenarios clearly labeled. It's important to remember that the human reality at the center of all 3 is the same: a person navigating a serious illness and a family navigating it with him. The institutional questions exist alongside that, not instead of it. 3 people whose positions are worth understanding in the current context. Prince William. The Prince and Princess of Wales have taken on a significantly expanded public schedule. This is publicly documented and acknowledged. William has delivered more formal addresses, represented the Crown at more international events, and maintained a consistently visible public presence. That visibility serves both an operational purpose and a public confidence purpose. He is positioning himself as present, capable, and steady during a period that requires exactly that. Queen Camilla. The Queen Consort has maintained a consistent and composed public schedule throughout. Her appearances have been well calibrated, present enough to signal that the institution is functioning normally, active enough to demonstrate continuity. Her communications throughout this period have been measured and consistent with the broader palace messaging approach. Prince Harry. Harry's position is publicly complex and worth addressing honestly. He is not part of the formal working royal structure. There have been reports, from unnamed sources, which I note as such, of increased private contact with his father. What is verifiable is that Harry has made public statements expressing concern for the king's health. Beyond the public record, I will not go further. The public conversation about Harry's role tends to generate more heat than light, and this channel tries to stay on the side of light. Now here's what that means going into the final section. Your questions. 4 questions that come up most often, answered directly. Is any of this confirmed? Everything I have presented as confirmed is drawn from official statements and the documented public record. Everything I have presented as reported but unverified has been labeled clearly. If I cannot verify something, I tell you that. That is the standard this channel holds. Why does the palace give so little detail? This is deliberate and historical. The monarchy has managed information tightly, particularly around health matters, throughout its modern history. The calculation has traditionally been that a controlled, limited disclosure creates less immediate disruption than a fully detailed one. Whether that calculation still holds in a modern media environment is a legitimate question, and it is one a growing number of commentators are asking openly. When will the next update come and where should I look? The official royal website and Buckingham Palace's verified channels are your primary sources. The court's circular, the official daily record of royal engagements, is underused by most viewers and is genuinely useful. The BBC's royal correspondent is reliable for verified UK-based reporting. I will post an update here the moment new verified information becomes available, and I will add it to the pinned comment on this video. Which sources can I trust? Named sources, official statements, and journalists with documented, established access to the institution. Be appropriately cautious with anonymous palace insider claims. They can sometimes be accurate, but they cannot be independently verified by definition. This channel distinguishes between the two clearly, and it always will. Here is the one-line summary of everything we have covered today. The public record shows a significant adjustment in the king's schedule and in how royal duties are being shared. Official statements confirm ongoing treatment. The difference between the level of detail in those statements and the level of public curiosity around the situation is something that will continue to shape coverage in the weeks ahead. It's worth remembering, as always, that beyond the institutional questions, this is a personal health story, and that Dimension deserves its own respect. What is your read on this? Do you think the palace's current level of communication is appropriate, or would more transparency actually serve the institution better? Let me know in the comments. I read everything. If a significant new update comes through, an official statement, a verified schedule change, anything that moves this story, I will add it to the pinned comment on this video so you have it in one place without needing to go anywhere else. Subscribe so you don't miss the next update. I will see you then.